Hi, this is Dr. Vital, and I'd like to explain keratoconus, the other corneal ectasias, and anterior lamellar keratoplasty. The cornea is the clear dome on the front of the eye that does most of the work of bending light so that it is focused on the retina. In order for you to achieve good vision, the cornea needs to be clear and the proper shape. In keratoconus, which is a type of ectasia, the cornea becomes misshapen over time. This corneal shape irregularity can worsen over time, is a hereditary condition, and can lead to extremely blurred vision. We know that it can be worsened by extreme rubbing and allergies. In these diagnostic pictures, we can see the normally shaped cornea pointed to by the blue arrow and the abnormally shapened, steepened corneas caused by keratoconus and ectasia. Keratoconus often causes corneal scarring and severe astigmatism. Although glasses are sometimes enough to correct the vision of someone with keratoconus, more often keratoconus patients require rigid contact lenses and/or surgery to get adequate vision. When evaluating for keratoconus, we use a device called a corneal topographer to evaluate the shape and thickness of the cornea. When surgery becomes a necessity in keratoconus, the front layers of the cornea are removed and replaced in order to flatten the cornea and give it a more regular shape. Incidentally, this type of corneal surgery can also be used to get rid of corneal scars that are in the front half of the cornea. These images are intraoperative photos of the anterior lamellar procedure being performed. Keep in mind that there are many types of corneal surgery for keratoconus, including lamellar keratoplasty, penetrating keratoplasty, intacs, and collagen cross-linking. Anterior lamellar keratoplasty has the advantages of being an extraocular procedure, having reliable placement, no risk of endothelial rejection, and stronger wound healing than penetrating keratoplasty. Once the procedure is completed, we can see the varying layers of the cornea. The blue arrow represents the cornea that has been replaced in the front of the cornea. The red arrow represents the residual cornea that's left behind, and the black arrow represents the interface between the new and old corneas. After 6 months, once all of the corneal sutures have been removed, the patient can then see an optometrist for refitting of a rigid gas-permeable contact or scleral contact lens to restore good, sharp vision.